Healthy You on KFDX is brought to you by United Regional. You're watching KFDX3 News in HD.
Well, pregnancy can be an exciting time, but it's also when a woman's body goes through major changes.
While signs are not always obvious, in this evening's Healthy You, United Regional's newest endocrinologist explains what may happen if you develop gestational diabetes.
When expecting, it's also important to plan for the unexpected.
Having so many physiological changes going on during pregnancy, including weight gain, the insulin is not as effective as it would be in normal situation, and that's why some people do develop this form of diabetes.
United Regional endocrinologist Dr. Ritika Jaiswal is talking about gestational diabetes, which is usually recognized during the second or third trimester. If caught earlier, it's likely diabetes that went undiagnosed.
Frequent urination or frequent thirst. But again, those can be the common symptoms during the pregnancy, so it's so hard to tell if you are really having symptoms from gestational diabetes.
Because the signs are not always clear, your doctor will run a test around 6 or 7 months. That's about 24 to 28 weeks into your pregnancy.
One test includes a very sweet drink that a doctor would ask you to drink in the office, and an hour or two later they would check your blood and will see how your sugar numbers are after that load of carbohydrate drink.
There is a long list of risk factors, so if you are at risk, Jaiswal suggests trying to lose weight, avoid smoking, and do normal physical activity before trying to get pregnant.
A previous history of gestational diabetes, or like a borderline diabetes called prediabetes, his family history of having diabetes, previous history of a baby being born weighing 9 pounds or more. Certain race or ethnic groups are more prone to having the gestational diabetes. You can speak to your doctor if you are falling into that categories. Also, if you are overweight, it can put you at risk for developing gestational diabetes.
If not taken care of, gestational diabetes can put you and your baby at risk.
For you, it will be more likely to have a kind of high blood pressure. If you have gestational diabetes, your baby can be at risk for being born weighing high 9 pounds or more, which can cause difficulty during the delivery and can lead you to having C-section. Your baby can have low blood sugar, and also your baby can have a risk of developing diabetes in the future.
So before welcoming that new bundle of joy, listen to your body and also know you're not alone. Now, some women may be referred to their OB/GYN to an endocrinologist like Dr. Jaiswal, who specializes in diabetes treatment.
Taking care of gestational diabetes looks different with each patient and may mean a new diet, exercise plan, or medication.